Good morning, everyone. We welcome you this Saturday morning to the next installment of our webinar series. This time on Alzheimer's and Dementia: 10 Warning Signs. This morning, our presenter is Ms. Sheila Griffith. She's the Vice President of Programs and Services for the Alzheimer's Association National Capital Area. She coordinates and provides education and outreach through the delivery of programs and coordination of services about Alzheimer's disease and other dementia in Montgomery County, Prince George's County, Southern Maryland, DC, and Northern Virginia. The services that they provide include community education programs, community forums, providing information and referral services, caregiver support, and memory cafe groups for those living with Alzheimer's disease and their caregivers. They strive to provide services to seniors and their families in all communities, but especially in the most underserved and underrepresented in our area. Ms. Griffith is also a licensed nursing home administrator in Maryland and with a background in long-term care and senior housing, such as skilled nursing, assisted living, and group homes. Caring for those with Alzheimer's disease and dementia and their caregivers has been her passion throughout her career. So without further ado, we present to you Ms. Sheila Griffith with the Alzheimer's Association.
Good morning. Thank you for having me. This is wonderful. Great to be here.
Thank you for joining us.
Thank you.
So jumping right in, I don't think people realize that I guess there's a subtle difference between Alzheimer's and dementia in general. Can you speak on kind of what the difference is?
I can. I'm glad to have the question. That's one of our number one issues and questions that we have to really talk with people about, because sometimes you think those terms, Alzheimer's disease or dementia, could be interchangeable, and they're really not. And so I'll just start by saying dementia is we consider it an umbrella term that really covers many different symptoms. So somebody with Alzheimer's disease or somebody with dementia, I should say, could be leading to Alzheimer's disease or other diseases. So, but some of those symptoms of dementia, things are not quite right. Maybe I'm having trouble with my memory. I'm having trouble with thinking, planning, those executive functions. Something's not quite right. And the other thing is that it has to really affect my daily living, my activities of daily living. So many people I know, as you grow older, you feel like your memory is not as good. And so that's kind of normal aging for a lot of us. But for some people, it could be a sign that they might be developing dementia, and the dementia could be leading to something like Alzheimer's disease. And then I'll just say that Alzheimer's disease is the actual disease, and it's a progressive brain disease. So, and that's what we at the Alzheimer's Association, we are hoping to work hard to find a cure. We're raising money as well as trying to educate the community like today as much as possible. And really, I hope one day to come back and say, hey, we have a cure.
And it's, I guess, interesting that you touched on some of the symptoms. So I guess maybe if you can go a little bit more in depth, that I guess there's a difference between just being a little forgetful and then like serious memory lapses. Because I know sometimes I'll walk into a room and forget, like, why did I come in here? But that's not exactly the same thing as what, somebody might be experiencing if they're, going through dementia or Alzheimer's.
I think I have a great high level slide that maybe we can show that really kind of can give you all 10 signs that we think are signs of Alzheimer's disease. And all of these can be found on our website. And I have that in the chat. I'll just send that out to everybody. It's very simple, alz.org. But high level, then I think the cornerstone, the number one sign that we usually hear people say is that the memory loss that disrupts daily life. So a lot of us are not experiencing dementia or not experiencing memory loss that disrupts our daily life. We're, going to the next room and really can't recall why we came into that room, what we were going to get. But we have, certain parts of our brain still functioning that can help us retrace our steps or remember what we were doing in the next room. But that number one sign for somebody who is really experiencing this memory loss that they don't even remember that they walked into this room to try to find something that they forgot. They're just into the next phase in this room, totally not remembering that there was something they were coming in here to get. And if you look at that that's the number one sign. But if you look at the number 7 sign, I think they're really connected. So there's a part of the brain with dementia first, but then dementia that's leading to Alzheimer's disease. That number 7, we actually lose that ability. You misplace things and you don't have that executive functioning left in the brain. It's been maybe progressively destroyed if it's Alzheimer's, that we lose that retracing steps. And it's such an important function, and it's really debilitating. And that's what really leads to memory loss that disrupts daily life. But you can see, all 10 of these. Many times, if you know somebody with Alzheimer's disease, or you know somebody who cares for someone with Alzheimer's disease, they'll probably talk about a lot of these different signs happening at one time or another. And I have to say also that you don't have to have all 10 of these signs to have Alzheimer's disease. These are signs that something is wrong and that you should get it checked out. It's serious, that it's on this 10 warning signs, that it should be checked out. And that's by a doctor and a neurologist.
Thanks, Sheila. And I guess when you're getting to the earlier stages where maybe these signs aren't very clear, you're not sure, or maybe, especially if you live by yourself, if you're someone going through this, you might not even realize that there's a problem. Are there any general recommendations in terms of once you hit a certain age, you should just get screened, or or do you typically wait until problems start occurring?
Well, you typically wait till you notice a problem. Now, I think it's interesting that you asked this question too, because a lot of times, if I'm experiencing the problem, the memory loss, or maybe I'm not retracing steps, or I'm having trouble, getting to the grocery store, doing my shopping, and then getting home again. I'm getting lost. I'm forgetting why I'm in the grocery store. Even the groceries don't cue me. And I finally make it home. I will say to myself, I'm just having a bad day. But my partner or my neighbor or my caregiver will say, what? You just got lost going to the grocery store you've gone to, for 30 years. And in a grocery store, it's kind of, you start on one end or the other. It's somebody who's in a grocery store just looking lost. That could be a real problem, that even associating with these groceries, I don't know really what I'm supposed to do. So I'll say that it's usually family, partner, caregiver, neighbor, even, that notice the problems. We ourselves usually try to say, well, it's a bad day or a bad week or a bad year. I'm having a bad year with my memory. It's going to come back, or it'll be better. We all should be screened at the Alzheimer's Association. We want everyone to think about this and try to get a screening. Now, we really say it has to be, people mainly who are 65 and older. And there is what everybody who is on Medicare or Medicare eligible has what's called a annual wellness visit. And in that annual wellness visit, they'll ask you, and this is 65 and older, all about your health, all about your blood pressure, take your blood pressure, weigh you, talk about any kind of issues going on, high cholesterol, whatever it is. How are your prescriptions? Or, what's happening with the drugs you're on? But they hardly ever ask you, how's your memory? And what the Alzheimer's Association is doing right now is really talking with health systems and physicians and nurses to say, this should be a really integral part of that wellness visit for those 65 and older. But we also advocate it should be for even younger. If you feel like in your 40s, that maybe your memory is not what I'm describing, not just normal aging, maybe it's a little more, then you certainly should go get that checked out.
And have we seen Alzheimer's or dementia develop in people that young?
Yeah, and that's a great question too. So I will tell everybody that we are every year. I've worked for the Alzheimer's Association 6 years. Every year, our number of those affected and living with Alzheimer's disease increases, unfortunately. So we're almost 7 million people in the U.S. living with Alzheimer's disease in 2024. And that number, out of that 7 million, probably about 500,000 are under the age of 65, and they develop what is called younger onset Alzheimer's disease. Now, this could be as early as the 40s, 50s, anything below 65. An interesting thing about just Alzheimer's disease in general is that now the research that we've been hearing about and reading about recently, maybe people have read this, that there could be changes in the brain that I'm developing Alzheimer's disease. I'm in my 60s or my 70s, but I had changes in my brain 20 years prior to that. And so there's a lot of research right now trying to study that. Is there something we can do for someone in their 40s who may be developing it already in very, very small, subtle, incremental changes? And certainly the people who have younger onset Alzheimer's disease, this is it's just a much harder part of our disease, of Alzheimer's disease, because somebody that young has probably children, has a mortgage, has a job, has all sorts of things that are going to really be affected terribly by this disease. It's not any better when you're over 65, but at least mostly you're able to retire or going to retire, and you maybe have a little less responsibility, as an adult. But when it's earlier, it's much worse. And statistically, people with Alzheimer's disease will live with it anywhere from 2 years after diagnosis to, I've seen in a nursing home, even somebody close to 20 years living with Alzheimer's disease. So that's something else about Alzheimer's disease, is that it's very individual. How it affects me is different than how it affects you. And, I can keep driving and still be doing pretty well and not getting lost and kind of managing, where at the same time, the same age, somebody else cannot drive anymore. That kind of part of their functioning of their brain is very affected by the disease. So they cannot, maybe drive anymore. So it's a very individual thing, how it affects us, progresses through the brain in different ways for different people.
So something interesting you said was that we have, every year we have more and more diagnosed with either Alzheimer's and dementia. Is that a function of increased lifespans, or are we actually seeing percentage-wise more and more cases?
I think it's increased lifespan, but it's also increased research and increased diagnostic tools. So think about 100 years ago, we have a great program where we kind of start from the beginning, and it's the early 1900s, and there was actually a Dr. Alzheimer's who diagnosed this disease. He didn't diagnose it with MRIs or PET scans. He had to diagnose it after death, during an autopsy of the brain. So they could see these brains were not normal. There was something they call them plaques and tangles. And the brain actually shrinks with Alzheimer's disease. So a healthy brain of someone who died from another cause would be pink and, normal size. And with Alzheimer's disease, after enough time, it actually shrinks it and makes it a darker color. So there have been so many changes, as you can imagine, from the early 1900s to now, not only with diagnostic tools, but research and also drugs, medications for symptoms, as well as, fast forward to now, 2024. In the last 3 years, we've had new drugs come on the market that actually affect the biology of the disease in the brain versus drugs prior to the 2020s that really just helped with the symptoms. So if you've ever known anybody with Alzheimer's disease, maybe in the past, they probably were treated. They were diagnosed and treated maybe with an over-the-counter, or not over-the-counter, prescription drug, but a pill form that they maybe took for a period of time, and that would help them with their memory. It wouldn't cure their memory, wouldn't bring their memory back, but it wouldn't go so quickly, maybe kind of plateau them a little bit. And so just helping with symptoms. But fast forward from the 1900s to now, we have a lot of hope that we'll have some drugs that today and hopefully in the near future that are, more reliable and that actually affect the biology or stop the progression. And we'd love a cure, but we'd also like to stop the progression. If I show signs now in my 50s, then and I can slow the progression so that the really hard symptoms that are disrupting my daily life happen in my 80s, instead of happening now or in my 60s, then I'm, of course, this is a drug that I want to be taking for Alzheimer's disease. So great question. And we have, people always ask that too. I have a slide that shows populations at highest risk. Here it is. And so these are all research issues that are we've discovered through research and that we continue to research. So if you can see, the populations at higher risk are Black Americans are about twice as likely to develop Alzheimer's or another dementia, and Hispanic Americans are 1.5 times as likely. And then the last one is 2/3 of Americans living with Alzheimer's are women. So these statistics are staggering, and we want to know why these populations are at higher risk. I can tell you the lifespan one for the third population, women. That's what they always used to say is, of course, there's more women with Alzheimer's disease in the world, in the U.S. and in the world, because they live longer. But what they've realized is that's not the case. First of all, men are starting to live as long as women now. The lifespan of all men has increased over, probably since the 1900s and on. But there's something about the biology of women and our brains that is making us more likely to have Alzheimer's disease than men. So really important issues to know why, if you're in any of these populations, why are you at higher risk?
And I was going to ask as well, between Alzheimer's and dementia, and we did get another question in the chat. You kind of touched on this before as far as what the difference is, but do we know the differences in terms of what causes each? Do we have a good understanding of why certain people get Alzheimer's or dementia?
I think, let me show my graphic. This is my really good umbrella graphic for dementia. I probably should have showed this in the beginning, but this really shows you, I said earlier, it's an umbrella term. So it actually is describing some of the symptoms that, as I said, are severe enough to interfere with daily life. But it's also showing types of dementia too. So dementia is not only a way to describe symptoms, it's also a category of diseases. So you can see that on the right-hand side, Alzheimer's is the number one, the highest percentage of somebody who's developing dementia, and it's moving to, it's increasing and getting worse. It's probably moving to Alzheimer's. That's the highest percentage of people who develop dementia develop Alzheimer's disease. You can see under that is vascular dementia, Lewy body dementia, frontotemporal lobe dementia, other, and then mixed dementia. So it can have dementia from more than one cause. All of these could be hereditary at some point. If you, people ask all the time, if my grandparent or parent had Alzheimer's disease, does that mean I'll develop it? And the answer to that is no. It doesn't mean you'll develop it. It means that you could be at higher risk for it. So the same as if your parent or grandparent or sibling has cancer, you should be screened for that type of cancer because you're a close familial, relative. And same with all of these types of dementia. And if some of these dementias, people could be at higher risk if they've had ever multiple concussions. There's, research that shows any kind of brain injury probably will put you at higher risk for developing dementia and Alzheimer's later on in life. People ask me all the time too, can you develop more than one of these types of dementia? And the answer is yes, unfortunately. You could have something like vascular dementia and Alzheimer's disease. So vascular dementia is a common dementia in that anybody who's had a stroke, who has maybe any kind of artery issue or even a congestive heart failure, any vascular problem could be at risk for vascular dementia. So that's something I could be at risk for. My grandmother had vascular dementia. So she never had dementia until she had a stroke. And then after the stroke, we noticed that she did have, was not tracking. Her memory wasn't any good. And, things kind of developed from there. So everybody could, if this is in your family, everyone should be aware of this and should be able to get tested or talk to their doctor about it and find out when they should be tested. The next slide I'll show is just, now this is the real Alzheimer's slide. And so Alzheimer's disease is the brain disease, where dementia is, just kind of talking about, could be any of those diseases or could be any symptoms. Alzheimer's disease can be diagnosed with testing. And the symptoms, as I said, usually grow severe enough that it interferes with daily tasks. So as I said, I'm kind of in denial. I'm thinking I'm just having a bad week or a bad, year, but those symptoms are going to probably get more severe over time. So I'm not going to just live with this little bit of memory loss or a little bit of problem functioning in my life. It's going to become debilitating after a while. And Alzheimer's is progressive, and there could be, as I said, anywhere from really 2 years to 20 years living with this disease, unfortunately. And unfortunately, also, the disease is ultimately fatal. So we're working hard to try to find a cure, or, as I said earlier, drugs that can then halt the progression and just, anything that might be happening normally to me, say in my 70s, that I can push that out to my 80s, and deal with it then, have drugs that can help me live with it. So that's kind of Alzheimer's and dementia in a nutshell.
Thank you. And I guess backing up just a little bit with the different types of dementia, since
Oh,
you
yeah.
mentioned, I guess, brain injury, do we see a correlation with folks in like violent sports like boxing or football have higher rates of dementia or Alzheimer's, or is CTE under that umbrella? Can you talk about that?
CTE, CTE should be in there. And that's kind of it's a whole problem in the US for sure, and probably in the internationally as well. But here in the US, yes, we have research has shown that anybody who is in a sport that they are likely to get a head injury, or they have gotten a head injury, even concussions. Now, I remember growing up, when you said a concussion, it was no big deal. It was just like something that might have happened in a sport you played, or even in a car accident. Oh, okay, it wasn't a serious car accident. I just got a concussion. That's it. I think nowadays we're taking this much more seriously. We're actually screening high school kids and maybe younger. I know my kids, when they're in high school, were screened for a concussion. And if anybody on a team seemed like they did get some kind of head, even a head bump, doesn't have to be a whole full, laying out on the field and knocked out. They need to go into these concussion protocols that a lot of schools now have, where they need to, be examined, see a doctor, be on, away from the sport, whatever the protocols are. But I think you've hit that on the head, the nail on the head there, is that anything like boxing, I don't know if, I'm sure everybody remembers Muhammad Ali. He's a great example of, a great boxer. But at the end, he suffered from at least one of the dementias. So Parkinson's is another, it's kind of under other with Huntington's, where Parkinson's disease is different than Alzheimer's disease, but it's a brain disease as well. And so whether that was brought on by boxing or not is, I think, still up in the air. I don't know if that was the case, but I think any kind of head injury, we have a lot of documented research now on NFL players that, many in later life are developing dementia or Alzheimer's disease. And they think it's a result of playing professional football.
Yeah, I know, we don't want to scare people out there, but at the same time, we want people to be informed and know, and especially like you mentioned, don't brush it off. Like, if you get in a car accident, or maybe you just have an accident at home, don't just feel like, oh, I'll just sleep it off or something. Like, you need to go to the doctor. Like,
yeah, and please get it. And also, it's not that the first time you maybe because maybe at a certain time everybody's going to have maybe a little bit of a concussion, like even the most safe of us, who don't have, are not playing sports or anything else. It could happen to anyone. And just because you've had one doesn't mean you're definitely getting dementia or Alzheimer's disease. But what the research is showing is that there is a correlation between that. So limiting your risk is really, I think, the name of the game for almost everything we have nowadays, is making sure that we limit the risk of developing any of this type of dementia diseases, or anything really in our lives.
And then let's just say you are at a higher risk, or maybe you find out that you have it or you're developing it. Well, what kind of treatments are out there? And do we find that they're effective? Are they getting better, or we're still not quite there yet?
I have a great treatment slide too. Let me just get through that. This kind of goes hand in hand with the treatment. So it's really the importance of early detection. So how do I know if I have a problem? If I think about it today, if I've had multiple concussions, say, or I just had one bad bike accident, maybe, and, was wearing a helmet, but still, or maybe wasn't wearing a helmet, whatever, should I think about getting, tested? And the answer is yes. It's very important to detect this disease, Alzheimer's disease, early. And so paying attention in any kind of brain functioning, if there's a problem, of course, with memory, we all know that, but the thinking or behavior that you notice in yourself, or that somebody else notices in you. As I said, I think that's the most common way, partner or neighbor or friend or family member saying, hey, you don't seem like yourself lately. Pay attention to that. And take action, having a conversation with your doctor. It doesn't mean that you have to go to the memory clinic at Georgetown University. It just means you have to call your primary care physician and go in and have a conversation about what you're noticing about yourself. And then from there, there'll be testing that can happen either through the primary care physician, or maybe most times you're referred to a neurologist, and there's definitely tests that they can run, that not only memory tests, they can give you a simple memory test or a more complicated memory test, or then there's also MRIs and PET scans that can detect any kind of change that's happening in the brain. The reason why we want people to be diagnosed early is these, as you see on the slide here, planning for the future, making sure that you, no matter what age you're experiencing these changes, and no matter what the diagnosis, that you have your future plans in place, especially if you had children or if you have any kind of responsibility, really financially or anything else, you need to get those ducks in order. But you can also, with the new research that's happening with Alzheimer's disease, explore treatment options. There's a lot of clinical studies, and just the 3 drugs that are on the market now, they came through clinical studies, studying people, giving them this drug, seeing if they benefited from it, seeing how their brain changed. So these are things that we're always interested in people getting involved in as early as possible. And I'll just show you these are some of just our treatment slide talking about those treatments. And I kind of talked about that a little bit before, that there are pill forms of medications that have been on the market for quite a while, that many people, if you know somebody who's living with Alzheimer's right now, or somebody in the not so distant past, they were probably on a pill or some medication that helped them with some of the symptoms, as I said. Today, in the 2020s and on, we are seeing these drugs that affect the biology of the brain and kind of slow. They're working on the biology of the disease in the brain, and we're hoping that they're slowing the progression. And these drugs, the new drugs, are IV drugs, so they're not a pill form. They actually, you have to go to a infusion center to actually get them. But you can see a lot of these really end up with talking with your doctor, doing some research, and you can see our talking about any of the treatments that have been currently approved in the 2020s. If you go to alz.org/treatments, you can really get a more in-depth description of the different drugs that are being used right now to treat Alzheimer's disease.
And we had a question in the chat, which you touched on earlier about, cases where someone pretty young, maybe even in their 30s or 40s, starting to develop signs and symptoms. Besides that, and also, I guess I've heard that there's a test now that you can test for like your risk. And some people might say, why do I want to know that I'm going to get a disease for which, there's no cure, like, just cause that stress and anxiety before you actually have symptoms. So, can you talk about that at all? Like the benefit of knowing something?
Yes, and I think that goes with the early detection slide earlier. That is exactly the issue that many people say, is that why would I want to know that I have a disease like this? And there are reasons why, and it's to try to prolong the time that you have and make it more of a quality time. There are things that you can do. Part of what I do at the Alzheimer's Association, and I didn't really cover this, but everybody knows the Alzheimer's Association. Everybody knows we have many fundraising walks, and we have a whole fundraising arm to our organization that is really what funds the research. So fundraising funds the research. But what about the other side of it? And that's where my team and I come in on the programs and services side. What we're trying to do, I think, is help people live with this disease. I wish nobody had the disease, but the fact is that many people do. And many people do in our area, in the National Capital area of Northern Virginia, D.C., Montgomery County, Prince George's County. We have actually a high rate of dementia in our area. So we're busy helping people live with this disease. And if you don't get the diagnosis, first of all, you notice that there's problems, your family notices there's problems, but you don't want to get the diagnosis because you just don't want to know. Well, it doesn't really change it much because you still have it, even though you're in denial. And it's hard when you're living your life and trying to live with whatever it is you have that you don't want to get the name of or say the name of. It's hard then to live with the disease. So for instance, you're going to, if I'm diagnosed with Alzheimer's disease, or I'm not diagnosed with it, I have it, but I won't get the diagnosis. We never put a name on it. We never call it what it is, which is Alzheimer's disease. So I'm going to start doing and saying things that don't make sense, that maybe really anger people or maybe even hurt them. And I might even, just hurt myself someday because I get back in my car and I shouldn't. And nobody, we're not talking about that I have a diagnosis. We're not putting a name to it. And I'm still driving and, I shouldn't be. So there's so many things that could happen. But the biggest one when I talk to caregivers is the frustration of living with somebody with Alzheimer's disease. And when you don't get that diagnosed, you're frustrated living with, say, me. I have the diagnosis. I'm forgetting everything. And I think that I'm not forgetting it. I think you're the one doing it. And so I become suspicious and, oh my gosh, it's a whole bunch of different things that actually seem like a personality change for me. And instead of blaming the disease, because we never got the diagnosis, you blame me. Why is Sheila acting like this? Why is Sheila always doing this? She's always ruining every holiday. What's wrong with her? Well, I have Alzheimer's disease. And so, do you know what I mean? So that's the distinction that we try to really talk to families and caregivers about, is that it's a much healthier thing psychologically and emotionally to be able to name something that's happening. And I say all the time, it's the disease that's doing it. It's not me. I don't want to ruin Thanksgiving this year. It's the disease. And so if the family knew that I had Alzheimer's disease, they might learn in some of our programs and services, and we have a lot of caregiver support groups, which really help with this a lot. They would learn that the worst thing for me is to bring me to a Thanksgiving dinner somewhere with 20 of my family and relatives and friends and disorient me, give me a lot of anxiety because I can't remember anybody's name, even though they're my family. And then you'll see me try to walk away, maybe wander away. I'm going to go walk home. and then we're calling 911 because I've wandered. So, you'll learn then, if you know I have Alzheimer's disease, it's better to have a small gathering for me than it is to put me into the middle of even my close family and friends. I'm going to start to have anxiety in large groups and not be able to remember people. And that really frustrates them and me. If I can't remember a child's name or, whomever, it's hard to, and maybe that child will say, well, what's wrong with Sheila? Why is she acting like this? Because they don't know that I have a disease, but you could have told them ahead of time. Hey, Sheila might not remember your name. Don't worry about it. It's okay. It's part of what's happening to her.
And what resources are there for caregivers? Because my grandmother had it. Fortunately, my father, he was one of 7 children, and they were all together in the Chicago area, so they were able to help each other take care of her. But not everybody has that kind of support system. So, are there things that they can get through the association or other organizations to help, they're at that wet's end and don't know what to do?
I'm glad that you're asking that, and I'm sorry to hear that you've experienced, your family's experienced this disease with a loved one. But that's what we try to do at the Alzheimer's Association, is really try to help people live with this disease. You had said earlier, we have, and I have said, we oversee and advertise our caregiver support groups. So these are support groups that are run by our volunteers. So we have so many people, wonderful volunteers in the community who want to help out. Either they've experienced this disease firsthand in their family, or they know of people, or, whatever it is that volunteers will get involved with us. And so we hold in our area over 30 caregiver support groups a month. For people to join. Most of them are virtual, some are in person, but as a way to just tune in, hear other people's stories. Me hearing about your grandparent experiencing and what your family did, and you just said that so beautifully, having multiple children, multiple adults to help care for or oversee the care. Sometimes we can't provide all the care that's needed for Alzheimer's disease for a loved one, but we can coordinate it, we can participate in it. The more people, the better. So if you have a family of 7 adult children, that's wonderful, because that person who's suffering from Alzheimer's disease is really probably going to get a lot of help and assistance and understanding and getting through their daily activities. But even somebody who has, very limited caregiving help in their caregiving circle, we call it, just their environment and their community. Trying to get other people involved, neighbors. It doesn't mean that you have to come over and, help me throughout the whole day. But if you can watch me and make sure I don't wander, make sure I don't try to get in a car, what am I doing? I have a routine. A lot of times with Alzheimer's disease, it's a great thing to keep me on a routine. I benefit from that, and I can function better when I know that, okay, we're going to follow what's up on this whiteboard in the kitchen. First thing breakfast, and literally I need to be reminded, first thing breakfast, walk outside or garden, have lunch, watch a movie. I need those kinds of reminders and that kind of routine. But we help caregivers, just as I said today, as we've been talking, Quentin, we help caregivers understand what the changes are going to be through education like this. I had a woman at one point, she was, her husband was newly diagnosed, not quite diagnosed actually, but they thought it was leading to Alzheimer's disease. And he was in the very early stages. And she tuned into one of our education programs one time, and she heard the presenter talk about wandering. Now, her husband was in the very early stages. We were just noticing that the memory was a problem, and he was forgetting his medications. So she was like taking some steps then to say, okay, I really got to watch him as he takes his medications and remind him maybe, and okay, so we can do that. When she heard us talk about wandering, she was like, "What are you talking about? You mean he could wander away?" Yeah, he could wander away from the home, and about something like close to 40% of people diagnosed with Alzheimer's disease will try to wander. Some do it, and some we catch them before they do, and some never do. So it's something with the short-term memory's gone. I forget that we moved to this retirement place, or I forget that we moved in with our son or daughter, and I'm trying to go home now. And the short-term memory is anything from now for the last 10 years might be considered short-term. So I go back, I want to go home to the place where we lived maybe 30 years ago. So I'm trying to, go walk somewhere, that I shouldn't be, and that I don't live there anymore. So we just help caregivers through our education and other services really understand the disease. And not only that, we help people who are diagnosed with the disease understand the disease, because that's, that it is very important for us to have that early detection and to know this is not my fault that I have this disease. This is something that's happened. We don't know why it happens, even as women or any kind of community of color, that why is this happening? We're going through research now to try to find that out. But it's not our fault that it's happened. We need to do more research to understand how we can lower the risk for this disease in that respect. But we're here all the time for caregivers and those with Alzheimer's disease. We have an 800 number I'll put into the chat also. That is just a helpline number, and you can see it on our website too, where you can call somebody newly diagnosed. I just got diagnosed and I don't know what I'm supposed to do. They talked about doing things. I don't remember what they said. That's kind of like the joke in the Alzheimer's Association. You've got to say it a lot of times, and you got to remind us because we won't remember. So our helpline is a great way for caregivers, people living with the disease, family members. Thanksgiving's coming up not too long from now. And believe it or not, I keep mentioning that, but this is a big time for people with Alzheimer's disease. You either come to Thanksgiving and celebrate Thanksgiving and you notice the changes in me. Oh my goodness, she wasn't like this last year. It wasn't this, she can't remember anything this year. But, you could learn more about how to really optimize somebody with Alzheimer's disease, how to help them and have them really behave optimally, that they enjoy it and that the rest of the family enjoys it. So Thanksgiving's a big one to think about coming up soon. But those are some of the ways that we really are trying to help people live with the disease. I have to say, put a plug in for our walks that are coming up soon. The Walk to End Alzheimer's. You've probably seen some commercials maybe on TV or heard them on the radio. But we, from late September through October, we hold 6 walks in our area. So our biggest one is a walk in Washington, D.C., which is on the National Mall. And that is September 28th. And, sometimes it's just a fun time. People who care about this disease want to raise money for it. It's been in their family and they don't want to get it, and they don't want their children to get it. This is a good way to raise money and try to get a cure for the disease. But it's also a great way for people to come together and really acknowledge that this disease is really affecting a large portion of our country, but also our area. And, sometimes knowing that you're not alone with this disease. I'm not alone if I have the disease, and my partner or my caregiver is not alone either in caring for me. There's so many other people that are going through what we're going through. And we always hope to bring those people together and try to make it easier, try to make it better, and try to help in any way we can.
Thanks, Sheila. And then, we talked a little bit about like the emotional aspect, time, and everything. Sorry, my daughter.
I like that music.
But what about the financial aspect? Does medical insurance cover everything? What about long-term care, the medications? What are things you can do to prepare ahead of time for like the financial pain of dealing with something like this?
I think that's a great question. And, we have a whole program where we talk about the financial aspects of this, because financially, this is devastating. It is a disease that devastates, obviously, the brain. We've talked about that several times so far. It kind of devastates the family in a way and the community, because it's something that affects everyone. So you talked about having a lot of siblings or a little, only a few siblings. It will affect the whole community. Somebody with Alzheimer's disease, as I was saying earlier, using some other people as examples, it might start off small where we just need medication reminders, but we can still drive, and maybe we can even still work, and we're okay with things for a period of time. But eventually we'll need round the clock care for somebody with Alzheimer's disease. And what this means is either having somebody come in the home, so having me live with someone, or have someone live with me that will care for me round the clock. So there'll be a point, if the disease stretches on, that I will not be able to speak. I may not be able to get out of bed any longer physically. And I'll eventually lose the ability to swallow, which is really kind of the end for anyone with any disease, but definitely with a progressive brain disease. It affects the ability to swallow. And then at that point, it's very near the end. So I will need round the clock care, nursing care, and putting that, keeping somebody at home and getting that kind of care. If you've never seen what that costs, you might not want to, because it's a lot of money. And it's not actually covered by Medicare in any way. And there is something called Medicaid that many people can qualify for. It's an income qualification. And that, in my experience, I've seen Medicaid pay for like a nursing home cost for people who have Alzheimer's disease. But you need to have no other assets in order to qualify for Medicaid. So it's not a great picture for us. And that's one of the reasons why we are raising the awareness of Alzheimer's disease and really ringing some alarm bells, because not only is this devastating and none of us want to get it, and it's really, sadly, this disease is robbing us of our memories, which in some ways, I don't know, maybe people would agree with me that that's one of the most valuable things we have. Losing memories is just an awful, awful thing. But then to also have to spend all our money and all of our family's money just to care for me is just, we think is something that needs to be changed and should be really brought up to Congress and to light, to say, hey, this disease is really devastating us. So there are some things you can do financially. A lot of long-term care insurance. I can tell you, I've heard in my nursing home career way back when, and say this is more than 20 or 30 years ago, there were some long-term care insurance policies that would cover things like in-home care or assisted living care. I don't think those policies exist anymore, because back then they were writing policies maybe that we didn't really understand the full scope and how long could somebody live with this disease. Well, sometimes they can live years and years and really need progressive care that becomes more expensive. So I think it's something that we don't have a lot of help with in the insurance industry either. So we really, we have a financial program where we just try to help people. We call it, just getting your ducks in a row, getting a will, getting a healthcare power of attorney, having all of these things prepared and signed by you before the disease really takes hold. And there'll be a time when I won't be able to sign documents like that anymore for myself. And there's some sad situations where people have never done these types of documents. They maybe don't have family or caregivers to care for them and actually need guardians, custodial guardians, which is actually a more expensive way to go, because that is a court process and everything, instead of just, paying for your will and having it done and all of the power of attorney things that you need, the documentation. Going through a guardianship can be very costly, and it's somebody that you don't know, and it might be a harder road. But for some people, that's it, just knowing how you're going to be cared for and by whom, and how those decisions will be made. Having that say in it earlier is the way to go. going without all that documentation and ending up with this disease where you don't remember, the people who are caring for you, the people who you're with, and you certainly can't make good choices for your care. That's the wrong time to be struggling with these types of questions.
Yeah, definitely. I guess because I know I've heard horror stories. I think there was even a movie about how some places will take advantage. If you don't have anybody and you weren't able to sign these documents, and now these places are, pretty much draining you dry until you have nothing left. I guess, do you recommend like putting your money in like a trust or anything like that? Or?
Could be. I'm not a financial expert at all. Maybe somebody who's on our program today would have better information. But what we always do is say go to alz.org, and if you look up financial or finance or financial considerations, yes, I've seen people do a variety of things. It depends on how much money, what the assets are. There are a lot of things people can do to maybe maximize their funds. Or in the case of, I'll use my grandmother as an example. She never had any assets. She always rented an apartment or her home. And so she had just what was in her bank account. And to qualify for Medicaid, say, specifically, which is what she needed with, as I said earlier, started to have mini strokes and then one big stroke and then vascular dementia. So she needed nursing home care. She qualified pretty quickly because she had very few assets, and they'll let you keep some of the money that you have maybe in a bank account, depending on how much it is. But there's a look back period and all that. So I can't just give you all my money and then say, hey, I have no money. The Medicaid process looks back, but you can pay for things like your funeral costs, burial costs, things like that, right out of your funds. You're not penalized for that. That's the kind of planning everybody wants to see people doing, is what's going to happen at the end, what's going to happen during this disease, and then what's going to happen at the end. Make those plans when you can still make them and you're still competent to make them. But go to our website, please, alz.org, to get more information about how to maybe view the financial planning program that we have. You can view it either, the next time somebody actually does a program like this one live, or we have a lot of opportunities to just look at the program online and take your time looking at it one-on-one yourself. But there's a lot of information. And I think probably, just like I say all the time, go see a doctor and talk about your memory. Go see an attorney and, and talk about your will and all the documents that you need to maybe be aware of that need to get done. And, it's just very, very important, and really a gift if you think about it, where my grandmother or was it your grandmother, Quentin, who suffered from Alzheimer's disease, having those wishes known by us so we know what to do, we know how to act in their best interest, so important. And sometimes just having these conversations, it's hard, and it's hard for me maybe to admit that I've been diagnosed with this, and but my loved ones need to try hard to talk to me and find out my wishes. It's well worth it. The pain of going through the conversation is well worth having known what the wishes were.
Definitely. And then I know we're getting close to the end of time. We have a few more questions in the chat from the audience.
Great.
First one, can a hyperbaric chamber help with slowing down Alzheimer's at all? Have you ever heard of that as like a treatment?
I never have. Wow. I wonder. I don't know anything about that, but I know what a hyperbaric chamber is. So I wonder that it's not in the research. Nobody's talking about it. The Alzheimer's Association, because we have a lot of PhDs and different doctors all the time. So I don't think so, but maybe that's something to Google and find out. I think right now what we talk about or what we advocate, you'll see on our website, and I'll say it right now, is that we all should try to lower our risk for this disease. There's some parts that we can't lower the risk. I'm a woman. I am in this category, this population that seems to have a higher incidence of Alzheimer's disease. So what else can I do? I can maintain a healthy body weight. I mean, all the things your doctor tells you. I can lower my weight or maintain a healthy body weight. I can take care of a lot of underlying diseases that are maybe chronic, like things like diabetes, thyroidism, high cholesterol, anything like that, I can really manage well. Get diagnosed and manage it well. Don't let it fall off the charts or skip your medication. Make sure you get diagnosed for these other underlying conditions and treat them. Something else that we always say is get treated for depression or anxiety also. When you are depressed, you are not going to want to lower your weight and increase your heart rate and exercise. You're not going to want to go out of the house if you're depressed. So get those other diseases under control. And something to remember is whatever's good for your heart is good for your brain. So all those things the doctor's telling you to get more active and things like that, definitely stop smoking. Limit alcohol consumption. Those are things that are also good for the brain too. So I don't know about the hyperbaric chamber, but I do know those are things we can do to increase our heart health and our brain health.
Thank you. And then the next question, if you can recap, do we know the stages of disease? Maybe that goes into the warning signs, but does that correlate with different stages?
I think that's a great question, and thank you for asking it. And we didn't really cover that, so I'll just say that also on our website, because I know we're running out of time, alz.org. And if you look at the stages, so very simply, the stages are what we call the very early stages, or mild cognitive impairment, MCI, a mild cognitive impairment. I feel like something might be wrong, or my partner feels like something might be wrong with my memory. It's mild cognitive impairment, meaning that I'm having those first symptoms of dementia, problems with thinking, memory, gotten lost a couple times driving, and I don't realize I should use my GPS on my phone because I can't really remember even how to use it. So those problems that I didn't used to have that I'm having now can be dementia symptoms, and they could be the beginning of what we call MCI, mild cognitive impairment. That's kind of like a stage, a pre-stage, where the doctor and the neurologist is terming that's what's happening to you right now. You've got MCI, mild cognitive impairment. We need to keep testing you and keep watching you. And I more than likely will progress to the early stages of Alzheimer's disease. Now, sometimes people kind of pass the early stage altogether because of denial and just coping mechanisms, or, a lot of times you see a couple, one who has maybe early stage Alzheimer's disease and the others overcompensating so that together they're okay. But if something happens to the well person, the well partner, you will see this person is not only the one who maybe has early stages, is now almost into what we call the middle stage. So the mild cognitive impairment, something's wrong. Early stage, something is definitely wrong, and I'm now gotten diagnosed with Alzheimer's disease. In the early stages is when we're going to try to make all those plans we talked about. I'm going to decide with my family or my partner, should I take any of these new medications? Should I take any of the pills that help with the symptoms? I'm going to start on those things early so that I can have a better time in this disease as I go, maybe lessen symptoms. But once I get to the middle stages, I'm really having a lot of trouble. I need constant reminders. I need to be supervised also, and to make sure I'm not getting lost, or I'm not just leaving the gas on in the kitchen, things like that. I've heard people who, in the middle stages too, people maybe turn the gas off, they unplug the range, only use the microwave, kind of transition, things like that. Late stage of the disease, so early stage, middle stage, late stage, is what I talked about earlier, where I'll need round the clock care. It's progressive, unfortunately, and this is fatal. So if I don't die from, say, a stroke or something else, I could actually succumb to Alzheimer's disease, which is eventually not being able to swallow or breathe, and that's how I would pass away in the stages.
And then finally, and we can go from this to, I guess, a general recap. Available medications, are there some forms better than others for different types of dementia, or Alzheimer's, or depending on the stage you're at? I guess can you touch on that again a little?
Yeah, there is, and sometimes it's not Alzheimer's disease. So we have those dementia symptoms that we talked about, and if you get checked out by a doctor, and fingers crossed, I hope for you to actually have something that is dementia, but maybe reversible. Maybe undiagnosed diabetes, undiagnosed thyroidism, a lot of these, a UTI, believe it or not, a urinary tract infection can lead to dementia untreated. So a lot of elderly people who are in nursing homes or just not caring for themselves as well as they should could have a urinary tract infection. So treating that infection or any of those other underlying diseases could actually help with the dementia symptoms. That's always what we hope. We hope it's not leading to this mild cognitive impairment and then the stages of Alzheimer's disease. But yeah, seeing a doctor, understanding what are the best options for you. Always talk to your doctor about any kind of medications you're taking or that you think you want to take or that they're prescribing. So nothing's perfect. We always have to do our research and make sure that, is a combination of this drug and this drug not good for me, or are they going to have side effects that I can't live with? So always be aware of the side effects too of a new drug you're taking. But I would say go to our treatments page, which is at alz.org. Read more about the treatments, either the pill forms that help with the symptoms or those new intravenous IV fusion forms of drugs that actually change the biology of the disease. Those are, still being studied, and we're hoping they're going to lead to the cure for this disease. But really, you need to talk to your doctor or a neurologist to find out what's the best medication at the best time.
Great. And once again, thank you, Sheila, for joining us this morning. As you heard, visit alz.org for plenty of information on caregiver support, financial resources, treatment resources. Anything else that we should leave as far as parting words?
I think we covered it. This was just a fantastic Saturday morning, and I thank you all so much in the audience. This was a real pleasure. Thank you so much.
All right. Thanks, Sheila, and thanks everyone for joining us today.